Welcome to Mental Health Monday. My name is Mick Coyle. Coming up on the programme this week,
making sure that government delivers on its previous promise of increasing benefits in line with inflation. That will make a massive difference to people.
What are your concerns about what might be coming down the line in terms of, people who are worrying, but not just worrying for a week or a month, but it becomes a sustained amount of worrying? What are the consequences for that?
Whether it's about soaring energy bills, whether it's about fuel prices, mortgage rates, rent rates, food prices, it all builds up to this kind of really big weight on our shoulders and not really sure what's the right thing to do.
And I'll be reminding you how you can make connections with mental health organisations within your community. It's Mental Health Monday. The home of the UK's conversation about mental health. Welcome to the programme, and we're back for another week. My name's Mick Coyle, got a great guest on the programme from the prestigious charity Mind. We'll catch up with their head of policy in a few moments' time. As ever, thank you to everybody getting involved in the programme. On social media, on Twitter and Instagram, you can catch me at Mr. Mick Coyle, Coyle, and we've also got the Mental Health Monday Facebook group. You will see that the artwork for that matches the artwork of the podcast, which you will see on your phone or device, however you're listening. And thank you for wherever you are listening. Do send me an email, drop me a line, drop me a tweet. Share that you're listening to Mental Health Monday. It's always great to see that the story's out and about, and that people are joining the list of loyal listeners, or one-off listeners who maybe want to check out previous episodes of the podcast. There's more than 260 of them, and they're all absolutely free to listen to. We're going to talk about the cost of living crisis this week. Now, I caught up with Mind on a day that it was announced that inflation within your supermarkets had risen to more than 10%. So something that cost £1 last year now costs £1.10. Now, that in and of itself for one item would be a problem, but when that's every item, of course, it starts to have an impact on the amount of money that we can spend. Throw into the mix the rising cost of mortgages, the medium to long-term impacts of the so-called mini-budget, which the government delivered and then completely scrapped, all but, when they realised it absolutely tanked the markets and, to a certain extent, large parts of the economy. So there's lots going on, some things that we can affect, and a lot of things, and I mean a lot of things at the moment, that we have absolutely no effect on whatsoever. We can't do anything about the price of gas. We can't do anything about electricity. There is only so much you can do in terms of not putting your heating on or not using, hot water at certain times before you need a bath or you need a shower or your kids need to have their clothes washed and so on and so forth. It's so difficult at the moment. I'm one of these people who did all this stuff a long time ago. Switching energy providers, well, that doesn't have an impact anymore. Switching your insurance, well, people do that now as a matter of course every year. Turning your degree down by 1 to save X amount of money per year. We've turned it down by 3, 4, 5 degrees. We're talking about it's down at 15 or 16 now. Switch supermarkets, stop buying branded cereals and all that kind of stuff. We've taken all that advice on board. A lot of people did that a long time ago, and still the money is not adding up when it gets to the end of the month. This is a cost of living crisis which is affecting everybody, but of course those who are at the lower level of family incomes and personal incomes are affected by this significantly worse. And Mind have done some work on this one to get a sense of sort of where people are at and how it's affecting people's connectivity. Because, of course, we can talk about bank balances and prices all day. But actually, the real impact is, what does it mean for people? What does it mean for real life? What does it mean for you, for what you can do and what your family can do? What does it mean about what the people around you can do? The life that you live, or the plans you're going to have to cancel because you simply don't have the money to afford it. Across the country, fuel is currently the top money concern for those people, 74%, who said they would normally drive to see their support network. They'd struggle to pay for public transport, with almost a quarter of people living more than 40 miles away from their support network, the people that they turn to. To give people a sense of the cost there, this time last year, 40 miles cost you about £5 in petrol, just over. Now, costs closer to £9.50. Big increase in the cost. Also, as a direct result of the cost of living crisis, almost a quarter, 22% of people, say they're seeing their support network much less than before. And then 2/3 of those say this is because of the cost of fuel alone. 17% say they struggle to afford public transport, which can often require multiple forms with multiple companies involved. And of course, some of us are taking matters into our own hands and we're going into sort of pandemic mode, with almost 42% are now back on the old Zoom calls instead, because it's easier to connect with people over a screen than it is to physically reach them in person. And sadly, actually, when it comes to worries about our finances, those worries are only increasing. Around 1 in 10 now say they worry about the cost of living crisis more than 3 times a day. This idea that it's actually not just a thing that is a bit of a concern. And, you sometimes, on a Tuesday night start to worry about it over a calculator and a piece of paper and, a list of your weekly outgoing bills. 3 times a day. These are people who are ruminating, catastrophizing over the cost of living crisis, the impact it's going to have on their lives and what they're going to do. So let's have a chat with Vicky. Let's talk through some of these stats and let's talk about the impacts of it. And of course, where people can turn if they do have concerns. Vicky is head of policy at Mind. And I started by talking about the fact that, even on the day that we caught up, a 10% increase in food prices in the cost of a year. No surprise at all that there is a real mental health impact from the cost of living crisis.
Absolutely. So we know that the cost of living is affecting us all, but it's especially affecting those of us with a mental health problem. So the research that we've published today is suggesting that a worrying number of people are struggling to afford to see the people we often depend upon, our support network. And that's important because our support network really helps us to cope with life's ups and downs. And we often spend time doing activities with our loved ones. And because of the kind of, whether it's fuel prices, rising cost of public transport, or the kind of energy crisis, all manner of things that are wrapped up in this cost of living crisis, it's restricting our ability to connect with loved ones, and that has a negative impact on our mental health and well-being.
I know we're at a point where we're still not fully aware of the long-term mental health impact of the pandemic, but some of the things you've just talked about there, making sure your support network is around you, actually throws us right back into that mix, doesn't it, of lockdown and not being able to see the people that you care for and who care for you.
Yeah, and I remember when we all kind of came out of lockdown, the joy it was to kind of be able to kind of connect, to see people physically be in the same room as people. So this is, kind of taken us back a little bit from where we were. I think there's important kind of things that we can take, the learning that we can take from the pandemic, where actually, suddenly everyone understood like what Zoom calls or video calls were and staying connected. So there is something about taking the learning from the pandemic and staying in contact with our loved ones, whether that's, if we can't see them physically, it's about making sure that we're connected through phone calls or video calls or text or emails. Just having that regular contact, is important. And if you can't physically see them, then make sure that you're making kind of connections maybe closer to home in your local community. Lots of peer support groups, art or gardening classes that might be happening right on your doorstep. You just might not know about them just yet.
Yeah, and actually, 1 in 4, 1 in 5 people say they see loved ones less. And 2 out of 3 are saying that the actual physical cost of petrol is the reason that they're not making those trips, that's a specific thing that you can quite clearly see from your survey.
Yeah, absolutely. And I think what's kind of added to that is the nature of this cost of living crisis. It's constantly changing directions, the kind of political instability that it's also brought. And it makes it really difficult for people to plan their finances. So even if they felt that they could have some money, they're not really sure what's around the corner. So they, don't want to kind of, spend that money because they might need it, because no one really knows what's around the corner at the moment. So it's understandable that we feel kind of slightly overwhelmed and maybe a bit out of control. At the moment, these are not normal times at the moment.
I was going to say, because actually there's a stat within your survey that says that many people are worrying multiple times in a day, and I think that's probably fair to say that we all worry, and actually in uncertain times it's quite a normal sort of emotional response. What are your concerns about what might be coming down the line in terms of people who are worrying, but not just worrying for a week or a month, but it becomes a sustained amount of worrying? What are the consequences for that?
I think it's really important when we're thinking about kind of mental health, is, as you rightly say, when we will all have to cope with life's ups and downs, and be worried and struggle at times. It's about when it starts to really impact on your day-to-day living, where you can't do the things that you would have done beforehand because your mental health has deteriorated to such an extent that you just can't do those things. They're simply not options for you anymore. And that's when we'd really say, that's when you need to go and, talk to a loved one, but also seek professional help, go to your GP, because that's when it's starting to not just be a challenge, but it becomes a real problem that we have to deal with, but also can be treated, and you can receive the support that you need for that, and you can get better. So that's a really important message, to kind of be able to clock when it's starting to become more of a problem than just a kind of a worry that we all might have at times because of the nature of the situation at the moment.
I think as well, on a day where we've seen the supermarket prices, hit a 10% inflationary point, and we're heading into that Christmas period, aren't we? Where you've got to put things in your basket because it's Christmas, and you've got to spend money for various different reasons. I wonder whether or not actually even people who maybe felt they did okay during the pandemic might find a different challenge through this period of time, where they're suddenly, hang on a minute. What's going on? I can't afford to buy the stuff that I would normally buy. My life isn't as good as it was, and I'm having to make major cutbacks around that. That can be damaging for someone, can't it? And maybe for the first time, they have to get a sense of, I need to be aware of what my mental health is doing at this point.
Yeah, I think when with the pandemic, it affected lots of people in different ways. With the cost of living crisis, it's just the sheer toll of the different aspects of the crisis. So whether it's about soaring energy bills, whether it's about fuel prices, mortgage rates, rent rates, food prices, it all builds up to kind of this kind of really big kind of, it feels like it's like a weight on our shoulders, and not really sure what's the right thing to do. I think it's also really important for people to be aware that actually there is help out there. So if you are struggling with your mental health, then obviously you can visit our Mind website, mind.org.uk, and that's able to kind of signpost you to the kind of local services, our local minds, but also give you lots of information on mental health. If you're struggling financially and you want to know what might be available to you, then we, for practical financial advice, we'd suggest talking to Citizens Advice. But there are things to make sure that you're claiming any extra money or support that you're entitled to, because particularly with this benefit system, it's very complicated. It's hard to navigate around, and we know that some people are just simply not getting the support that they're actually entitled to in the first place.
Yeah, and you mentioned staying connected, of course, and it's about staying within your local area, finding what those groups are, maybe even for the first time, taking a look at what those opportunities are. And there's some fantastic services and organizations, groups, and there are men's sheds, and there are gardening groups, as you mentioned as well. Netball teams that you can join. Things for young people, kids as well. It does sometimes come with a financial cost as well, but some of them are free, and obviously that's beneficial as well. I wanted to ask you, Vicky, about from a point of view of when we connect with people, that actually it's almost on us as well to spot in the people we're connecting with that actually they might be struggling, that actually we can have a conversation with them about whether or not they'd noticed cost of living increases, and that maybe that you'd noticed that they hadn't been maybe communicating as much, that you'd noticed they were a little bit more withdrawn than they had been maybe, and opening up that conversation a little bit.
Yeah, such a good point. Connecting with people is good for ourselves, but it's also good for other people as well. And that is that kind of saying of like, a problem shared is a problem halved, but it's about it. It can help to make you feel that you're not alone in thinking about these issues or worrying about these issues, and vice versa. But it's also about kind of helping to put it in perspective. But you're absolutely right. You know your loved ones just as well as anyone else, and you can spot those signs and symptoms. You can probably spot them easier in yourself, in others, than you can in yourself sometimes. So having that conversation, having that contact, you can start to see when people are really starting to struggle, and be able to support them, whether that's through information that you can provide them, helping them to signpost, but also, if they need to, helping them to take that next step to seek help professionally.
And of course, this is all sort of a part of the conversation that what we can do in terms of our sort of local support groups, local communities, local families, and so on and so forth. But from a policy point of view, Vicky, I guess you're looking at the government to try and make things as easy as possible as well. Conversations around increasing benefits with price rises and so on and so forth. What's Mind's current stance on that in terms of what the government needs to be aware of in terms of the mental health impact, but also in terms of that, the physical, having the right amount of money to be able to pay for your groceries at the end of the week?
Yeah, I think there's three things that are really important for UK government to do. Firstly, is to acknowledge that the cost of living crisis has a very clear mental health dynamic and impact. If there's a lesson that we can learn from the COVID pandemic, it is that came far too late. That recognition that the impact it was having on our nation's mental health, and so we can see it happening right now in front of our eyes. The stats and the research are bearing this out. So acknowledge that mental health is part of the challenge, but also can help us get out, be part of the solution. Secondly, it's absolutely about kind of making sure that people have got enough money to live on, and that's why making sure that that government delivers on its previous promise of increasing benefits in line with inflation, and that will make a massive difference to people to be able to afford the things that are in their shopping basket, or to be able to kind of fill their kind of their tank so that they can see loved ones. So increase that benefits. And then lastly, it's again about implementing a promise previously made to develop a new long-term cross-government mental health plan, and that is about how government and different departments in government work together to identify and tackle the many causes of poor mental health, but also help to tackle the backlog. Because when we talk about backlog of services, we often hear about the delay for some of the physical health problems, but we've got 1.6 million people on a waiting list for mental health treatment, and a further 8 million that can't even get on the waiting list. So all of these big stories that you're hearing about in the news that all have a mental health element. So we need government to work much better together to tackle some of those problems.
Vicky, thank you so much for your time today. Really appreciate you speaking to us, and hope the cost of living crisis is something which ends sooner rather than later, but ends with a legacy which we can work with rather than things getting out of control.
Thank you so much.
I hope you've enjoyed this week's podcast. Thanks for checking out Mental Health Monday. My name is Mick Coyle. You can find me on Twitter at Mr. Mick Coyle. You can also find me, Mick Coyle, on Facebook as well. Don't forget, if you want to speak to somebody about your mental health, you can do so. The Samaritans, free to call on 116 123. You can find mental health services where you are. Just look for the Hub of Hope. Type in your postcode. It'll find those mental health services close to you. And for support in a crisis, you can text SHOUT to 85258. That's if you're experiencing a personal crisis, you're unable to cope and need support. Shout to 85258. That's a text line. Do get involved in those services. In an absolute emergency, always remember the number to call is 999. Thanks for downloading the podcast this week. We'll be back next week with more Mental Health Monday.